Welcome to Your Dialogue, a podcast where we deep dive into digital health with experts from the field. YOD, or Youth Ownership of Digital Health, is a community of young digital health professionals from across the world. You can click the link in the description and become a member. Today's episode is a part of a very special series celebrating the Digital Health Week, a global week of action to promote digital health as a means of accelerating universal health coverage. We're dedicating each day of the week to a specific theme on digital health, and today's theme is scaling digital public infrastructure to achieve universal health coverage. My name is Sarah, and I'm a program associate at the Digital Health team at Path India, and I'll be your host for this episode. We are proud to bring you this series co-hosted by Youth, Transform Health, and Young Experts Tech for Health. Today's guest is Priya Vora. Priya is the CEO of Digital Impact Alliance, and she has over 20 years of experience working to empower marginalized communities with political voice and economic opportunity. Her background includes setting up the digital development team at the USAID Agency for International Development and establishing the financial exclusion practice at the Gates Foundation. Priya, we're very happy to have you here with us.
I'm delighted to be here. Thanks for having me.
Wonderful. Priya, first of all, I'd like to begin with the question. We've been hearing the terms digital public infrastructure and digital public goods quite frequently. Can you please explain what these two terms mean and why they're so important for social development?
Sure. Well, they're very important concepts, but I feel like we've kind of tangled ourselves up in DPGs and DPIs and DPGs for DPI. So I'll try to do my best to make it simple. But the concept of DPI really was inspired by so much of the trajectory of digital transformation in India. India has taken this incredible path where there's real government leadership and laying the basic foundations of technology infrastructure that really underpins any use case. If you're calling an Uber or trying to get some food delivered, or in a rural area trying to access veterinary services, for so many use cases, the common building blocks are the same. You need to be able to identify yourself, say where you are, be able to transact and get messages back and forth. And so for many of those layers, India and other countries have really noticed a huge difference if they, as governments, really take the lead in making sure that those technology building blocks are designed for inclusion, really low cost, not rent seeking, profit maximizing undertakings, but really designed for vast inclusion. And with some basic technology design components of modularity, interoperability, and so much more. So it can get a little bit wonky, but I think the premise is, if you want to modernize your economy, if you believe in digital as a driver of change and social change and economic change, often the government is really at the heart of determining how that infrastructure can reach population scale and really be governed in a way to maximize public benefit. The DPG language is related, but pretty distinct in the sense that DPGs are about, well, which kinds of technology building blocks do you use? Do you want to design it in-house? Do you want to, procure from the private sector? And in either case, do you want to leverage open source technologies that are already available to kind of tailor and meet your needs? So I think it's kind of a related point, but sometimes can almost detract from the larger point of government at the heart of change, at the heart of inclusion and trust.
Wonderful. So, DPGs and DPIs are really powerful tools, especially for lower middle income countries or countries with resource constraints or low engineering capacity given their open source nature. What do you think are some non negotiable principles that we need to have in place within the ecosystem so that things like DPGs and DPIs and other open source technology for good can really flourish and help us, achieve things like universal health coverage and development?
Yeah, and I guess I would say that the risk of not achieving those goals is as true with open source tools or not open source tools. So I think some of the principles that have to underpin any of the design and implementation choices are, how modular is your stack, right? Meaning you can swap in and out uh, uh, technology components as your needs change or as technologies evolve. That kind of helps in future proofing your stack. How interoperable are they? Are they extensible so that others can build on top of them in ways you may not, as kind of a lead implementer, really predict? There's a lot that kind of underpins it, but I would say that the risks of vendor lock-in, the risk of data hoarding, the risks of, costly maintenance and all of that, those can be just as true in an open source world as not. So I guess I would just say that the design thinking is really important, and the procurement thinking is equally important. And let's not just assume that open source equates to good, and certainly not equates to cheaper. Let me just tell you, I've seen examples where I used to be in the US government, USAID. I led the digital team during the Obama years. And certainly I saw a lot of contractors leveraging open source tools and saying, hey, we're going to build your digital health system or whatever system. And they would do it in a way that was so tailored that it made it virtually impossible to employ anyone else to maintain it in the future years. So, it's sure, that contractor got the benefit of using some free software. But from a government standpoint, now they're locked into that vendor. Who knows if the design and those kind of tailored aspects of the solution really are beneficial. So I guess I'd say the deep thinking around design and procurement is really, really needed to avoid any of those risks.
It's very interesting. I came across a study by Smriti Agarwal. I think she's from Hopkins, and their research basically looked into DPGs and the ownership of DPGs. So they looked at, I think, 92 DPGs, and they found that only 17 of those DPGs actually had manuals on how you could use them, while the rest had no document. So you were kind of you're dependent on the innovator of that DPG, right? So it's more, there's a power dynamic there.
Totally. Yeah, one of the tools that we've built at Dial is not only a registry of DPGs, so we kind of scrape different catalogs to surface which DPGs are out there. But what's interesting about the tool that Dial's developed is that it has this maturity framework. So it asks, how recently has that code base been updated? How diverse is the community contributing to the code base? Are there manuals and documentation of how to install and use it or whatever? I mean, there's a whole set of factors, and it's more nuanced, which nuance is never really easy to communicate. But I think we're hoping that through this kind of maturity framework, it kind of helps people make decisions around which are a little more robust and which maybe are not yet.
Yeah. Priya, you mentioned the word human-centered design. So we have this influx of technology for good and DPGs and DPIs coming in, not just for health and universal health coverage, but also for challenges that we are trying to solve to achieve our sustainable development goals. How human-centered are these innovations? Are people actually kept at the center of design when they're creating this technology?
I mean, that's hard to answer in kind of a broad swath way. And, I mean, I know it's trite, but like a butter knife can be used for good and for bad. And, and how do we think about, is it more or less people centric? It's hard to say. But, in this world, there's some things that are really, really at the heart of people centricity. So one is, in my mind, data minimization. Why would you collect a ton of data about people if it's not needed? And in fact, if doing so really excludes people, right? Like when I go downtown to change my name after I got married, I had to indicate, who's my father, what's his social security number, what's his religion, all sorts of crazy statistics or facts about me in order to make a simple change. And you think, well, A, why do they need that? But B, well, what if I was orphaned? What if my dad had passed away and I don't have access to those numbers? How hard is the system making it for me to um, acknowledge this name change or whatever it is? So that's just a really simple example and maybe a high class problem here in Washington, D.C. But I think that same principle of data minimization and being really thoughtful about what kinds of aspects might be inadvertently excluding already vulnerable groups is core to it. The second thing I would say is creating features of transparency and control, knowing who's accessing my data and why, for what, and having some ability, hopefully, to actually control those data flows. To me, that's so much a part of people centricity. And then, of course, there's a human-centered design, usability and, affordability and all of that sort of thing. But to me, a lot of the risk around technology boils down to how data is generated and governed. And to the extent we can minimize data collection and maximize control and transparency, we're probably in good shape.
Priya, I'm going to pivot my next question on data. So, generally speaking, there is a general consensus that data security is very important, and we need to comply, with all the regulatory frameworks to protect our data, ensure that the data is secure, and all of those things. But as a technologist or as an innovator, when I'm designing a product or when I'm creating a product, are these innovators or technologists motivated by the thought to ensure that the data of their end users is actually going to be protected and that data privacy laws are ensured? Or is that an afterthought post production, which comes in after the technology is created or deployed? Is that something which is central to the very creation of a technology, that thought that we need to protect the data of our end users? And a follow-up question to that would be, in the real world, how much ownership of the data do people like you and me have? Like, do we have ownership over our data? And how different does that look for people, say, like you and me, or someone working in a remote geography from an underserved community in the world?
Yeah, so I don't know if developers are motivated or not, but certainly they should be. And I think there's a growing movement around introducing ethics into software development and, into technology programs from universities. And I think that's that kind of multidimensional approach to understanding technology is so important. Does it all matter? Do we actually take advantage of the fact that we can change our settings on Google? I mean, I think Google will be the first to say they've been equipping people with certain controls for, over a decade, and many users don't take advantage of that right of theirs. So I think it's pretty complicated. But the answer can't be, well, then let's not do it, right? I think the answer has to come with, well, what are the meaningful ways that people can take advantage of having control over the data flow? So rather than concluding, gosh, people don't utilize these controls, or they accept, cookies and whatever, or are willing to trade their data for a slice of pizza. Those are all kind of cynical conclusions that I hear all the time. But I think the flip side is maybe more interesting and more constructive. If you do equip people with these controls, ownership, what can you build that allows them to change their lives for the better as a result of that? Can I meaningfully take my transaction history and get a better financing agreement from my bank, lower my interest rates or whatever. That's a meaningful improvement in my life. If I can, have my digital health passport or something, does it make it easier when I travel across borders to verify that I'm immunized or whatever? Are there ways in which it can meaningfully improve our lives? And I think a lot of creativity and needs to be applied to that question rather than just saying, as far as we know, these controls aren't being utilized, so let's throw our hands up.
Yeah. Priya, so we know that health has been a relatively late adopter of digital. It's something that the pandemic really accelerated, and now digital health has been positioned as this great enabler of achieving universal health coverage, which means that reaching the last mile and leaving no one behind. However, we know that there exists a lot of inequity and a lot of disparities. So, what would you say are some ways in which we can ensure that the benefits of digital transformation, which is happening in health, is equitable to everyone across the world?
So I'm actually really surprised to hear you say that, Sarah. I mean, I've always thought, and this is kind of a layman's view from afar since I'm not in the digital health community, but I've always thought they're pretty far ahead in the sense that, at least from a budget perspective, often the CIO office of the Ministry of Health has more resources than just the the digital transformation units or other authorities in government. So often they're more resourced. There's been a greater appreciation of the need to leverage or the opportunity to leverage open source tools. DHIS2 has been around for decades, longer than Aadhaar, for example. So, I mean, I guess I've thought it's very much ahead. And the question has been if that's true and if a lot of investments are going into digital health, how do you do that in a way that really serves broader economic and social issues? So if you're creating an ID for an immunization campaign, how do you do that in an infrastructural way such that that same ID can be used for a variety of not just health campaigns, but other uses in society? Or, you know what I mean? Or if you're thinking about consent and these tricky issues around, very, very personal data, right? That is important for me as an individual to have control over, but it's also important for public health authorities to access. That's just as true in the financial world. My finances are also very private and personal, but they really also can inform um, authorities around economic recessions and so on and so forth. So I think a lot of the questions that the health field grapples with could be more actively shared, and those issues that are being worked through could be done in a way that hopefully really addresses broader issues beyond health.
I absolutely agree with you there. Priya, you very briefly had a stint with digital health in Liberia on an ICT project. Would you like to share what that experience was like for you?
Yeah, well, yeah, very brief captures it correctly. At the tail end of my time in the US government, there was the Ebola outbreak in West Africa. And, for us in Washington, what was really disturbing was not only just the high, R naught value, the infectious rate or infection rate of the virus, but the fact that there you were getting no information about the case count around which hospitals had beds and so forth. So it was this eye-opening moment when policymakers, at least in Washington, realized that if you're going to stave off the spread of this virus, you actually have to have some basic infrastructure. You have to be able to connect with people on the ground. You have to be able to share data about what's happening. And we were, I think, amid what was a really devastating health outbreak there, the kind of silver lining was, at least for USAID, we were able to make the case, look, we're not talking about connectivity and data sharing infrastructure in a vacuum. This is really, really needed, particularly in this moment of crisis. So we got this special appropriations from Congress, who allowed us to invest much more deeply in both the metro fiber ring and Monrovia, trying to get more connectivity to the critical institutions, government institutions. And these are long-term plays, so it didn't have to do with the immediate crisis. But there was so much we could do if we leveraged both the kind of political will that really got unlocked in this emergency, the funding that got unlocked from Congress, and really created these mechanisms for cooperation because everyone had kind of different interests. So I thought it was a really important lesson for me about how you both really can see the importance of these horizontal layers of digital infrastructure, but also how to really galvanize money and kind of energy around some shared goals. I haven't been back to Liberia since, but I'm eager to understand how this has all made a difference, and it would be really heartening to see if those health facilities and people are really equipped with the kind of basic tools that hopefully can help in the next epidemic.
That's wonderful. Priya, you've been working with ICT for development for the last 20 odd years. You've worked a lot with women to enable them with microfinance and credit. With again this emerging ecosystem wherein we're seeing more and more ICT for development come in now for digital health. What I mean, some of the lessons you would like to share, because you worked so much with the community and for population scale digital initiatives, what are some lessons you like to share to anyone working for population scale digital initiatives? Or are there any models that you feel teams can replicate to achieve results from their initiatives?
Yeah, I started my career in development at the Gates Foundation, and there was something that Bill Gates used to say pretty regularly, which was, if you could wave a magic wand, what would you want to wish for, right? What change do you want to see? And I think sometimes in our space, in any development undertaking, you can get really stuck in the weeds of, this is what I'm trying to achieve. And that's really, really important, because a lot of the nuance and expertise is, has to be deployed in getting things done. But it's also important to be able to step back and try to answer that question of like, what are the bigger levers for change? What are the big problems we're not able to solve in this project by project way? And I really feel lucky that I had that early experience in my career, because, you can kind of straddle getting things done in a project way, but also stepping back and saying, if we look at the broader ecosystem, what are the organizations that still don't exist? What are the kind of ways to have almost a domino effect of change? And to me, that's a mindset that's really healthy for us to employ, so that we're kind of keeping our eye on the big wins, right? Um, The second thing I'll say is that, I have no technology background, which certainly puts me at a disadvantage in a lot of conversations. But what I would say for anyone who's interested in technology as a real driver of change is that in some cases, the best, thing you can do is just not be intimidated by the acronyms and the I don't know the tech components of this, and sometimes just being at the table and trying to, like, I don't know, pull on a string and ask questions that may seem obvious to the technologists, can can sometimes be revealing and actually helpful to the cause. So I guess I would just say to any young person that you shouldn't be intimidated. These are multidimensional problems. No country has figured this out, and I think the agenda needs lots of brains and creativity to really succeed in a way that people are included and really have trust in the systems and the data flows around them.
No, that was a wonderful answer, Priya. I'm going to ask you one last technical question, and this has to do with measuring impact of these initiatives in digital for social development, for health, to achieving UHC. I was actually reading a report that you had contributed to for the Brookings Institute, and this was on DPIs for SGDs, I believe. I'm messing the title up. And something very interesting that I read in the report was this non-linear relationship between outcomes and internet poverty, which is even more pervasive than income poverty. And I think that was just a very interesting finding in the report, and that got me thinking that with any initiatives that we put on the field, the impacts and the results are not in plain sight. They are indirect. They're not immediate, and sometimes you might feel that this initiative is not really doing anything. What in your opinion, what is some for anyone who's trying to measure impact for digital initiatives, how do we look at this problem in ways that it truly captures the results of that project or initiative?
Yeah, so I mean, I think that paper was written in I don't know, 2019, 2020 or something, and it's just as valid today. I started my career, and I was saying, at the Gates Foundation in development, working on microfinance, and it was the exact same thing, right? Getting people access to finance allows them choices. It doesn't guarantee that they make good choices, right? I can take out a loan and blow it on some dumb thing, right? And that happens. It also turns out that giving women access to finance at the exclusion of men can create gender dynamics that are really scary for women, right? If men feel kind of like their livelihoods or their manhood is threatened. We've seen the downside of microfinances, the services, or whatever. It's not a result of the service. It's just a result of the kind of dynamics that people live in, and certainly that not everyone makes great choices. And I say that because despite that being true, no one ever concluded, gosh, we shouldn't get people access to banking services. They said, okay, we should think about the world of consumer protections. How do you empower people with information about indebtedness and your options? Or how do we create credit bureaus that make sure you're not, or make sure you're, regulating institutions for good financial practices and not, threatening behavior towards clients or whatever. I mean, there's a lot of like problem solving that comes in. And there was still this incredible message around what it means to give women a safe place to save, what it means to give women opportunities to access credit to send their children to school, what it means to make sure that any mother can send their child to a doctor if he or she falls sick. So you have these heartwarming, really compelling stories of like why this all matters. recognizing that A doesn't always lead to B, that there's much more complexity in the picture. And I think the same is true in the digital environment. We can tell a really compelling story about the dangers of digital haves and have nots. What will it mean if in 20 years half the world is really excluded? What will it mean for global instability? What will it mean for, a variety of things? We can tell heartwarming stories about how people use these services in these surprising, wonderful ways to better their lives. But we also then, in practice, have to be very mindful that these investments in digital infrastructure and digital services aren't just, automatically mirroring that storyline, right? You have to think about the practices of involving people, of having metrics that tell you, are you going in the right direction or not? And my worry is that some of those practices and that maturity and understanding is still not there in the digital field. And I think that's the reason DIAL exists. We're really trying to shine the light on good practices, creating a community that acknowledges this is a real, this is a real profession, right? There's real considerations that have to be in place.
Priya, that was a wonderful and incredible answer, and I completely second every single point you've made. I think as implementers of digital or even change makers in digital, it's very important that we have a very holistic view of the ecosystem. So of course you can implement the technology, but is the behavior change going to be there? And have all of those components on board and work together, in a work together simultaneously to really enable and ensure that we are achieving what we set out to do.
Right.
So Priya, you have alluded to this during the conversation, but I'd really like to know. You're a woman in tech, and you're a leader and a wonderful leader in tech. How has that journey been like for you, and what have been some of the challenges that you've faced over these many years of work?
Gosh, that's a tough one. I've never really thought about that and, what it means to be a woman in this field. I'll say that it's totally surprised me. This is not the direction I thought I was going to go in my career. And, both my brothers are in tech, and as was my dad and everything. So I've almost escaped it my whole life, and yet here I am. And, and when I took over as DIAL a year ago, I was looking at our staffing pattern and thinking about what's the kind of change we're trying to encourage as an organization, and made a big shift to having more people in Africa, less in DC. And I'm really proud that as an organization, we have, a woman-dominated leadership team. And why does that matter? I mean, I guess to me, it matters because ultimately, if you want to have empathy for the end purpose, women's experiences are distinct from men. Thinking about how women use technology or are intimidated sometimes by technology, it's just really important. So I guess I don't think of it as a limitation to be a woman in this field, but probably an important advantage, and one where I want to lift up the kind of empathy and the questioning that comes so often from women in this field.
No, that's wonderful. Priya, I completely had a very similar experience when you said that you've tried to escape technology all your life. So was I. I never liked technology or anything related to engineering, and now I work in digital health. So funny how that comes around.
I don't know, but they need more of us. That's what I can say.
Absolutely, yes. Priya, with that, we are now moving on to the next segment of this podcast, which is a very original rapid dialogue. And I'm going to be asking you some fun questions, and you can, answer them in one line or one word. So, ready when you are? All right. So, my first question to you is what do you think is the greatest technology ever created?
The greatest technology ever created. Uh, oh my gosh, I have no idea. I have no good answer to that. Can I come back to that one? I feel like I can't do a rapid fire. Maybe my brain's not working yet. Only one cup of tea.
All right. Um, okay, so you said this during your interview. I'm sorry, during this podcast, about how if you had a magic wand that you could just shake and it would magically erase something from the world. So same question to you. If you had a magic wand, Priya, that could erase one social injustice or one evil in this world, what would you like it to be?
Well, let me take it from a tech perspective. I think this issue of data hoarding is super dangerous for everything we hate about being online today, whether it's, the micro targeting of ads, misinformation, bias in AI, whatever it is, it all comes down to how data is generated and governed. And maybe the flip side, going back to your first question, what's the greatest technology? I was so excited in college when web browsers came on, and you finally had this opportunity to ask any question you ever wanted. And it could be embarrassing to have asked a real person. Now it's so sad, right? You can't go online and easily ask a question because you're always wondering, oh my gosh, is that going to somehow show up in my feed later, right? I think the all of that comes down to how data is collected and shared. And if I could wave my magic wand, I would get back into that space where browsing really meant you could kind of get access to the world's knowledge without fear for repercussions.
No, that's very true. In fact, there is this very funny trend going on the internet these days, wherein people are asking ChatGPT to tell ChatGPT about themselves, and this is all the information that ChatGPT has collected about them via their questions, and these people are having an introspection moment with ChatGPT.
Yeah, exactly. Surprising twists, right? And all of this.
Yeah. Yes. Are you more of a morning person or a night person?
Morning person, 100%. Yeah, I like to wake up early when it's dark outside, the moon's still out, and I, make tea and get myself ready for the day. So I love the morning.
What was the last book you read?
I'm in the middle of Trust. It's a Pulitzer Prize winning novel, so I feel like I should read it. I really escape into fiction in the evenings.
What have been some fiction books you like to read? What genre do you like to read typically in fiction?
I love historical fiction. I feel like it kind of opens a window into new times and characters. And as a family which hails from India, and I've only been in high school there, so I haven't spent as much time as I would like. I love a lot of Arundhati Roy and a lot of the incredible novelists out of India, or writing
That's
about India, I should say.
yes. Um, what's the one superpower you wish you had?
I wish I could push pause on the world around me. Like if I could just push pause and then have an hour of free time to go for a walk or, think a little bit critically about this paper I'm going to write, but everything is so, I'm a mom of two and, running Dial and, doing a lot of things in my community and professional career. And I wish I could push pause on everyone and just take a moment for myself.
That's much needed actually for everyone.
The problem is every time you push pause in reality, you come back to, a million WhatsApp messages, emails, Slack messages, and it's just kind of, it almost makes it harder to take a break.
Absolutely, and you also get anxiety when you're away that, oh my god, am I missing something? There's that constant FOMO.
Yeah, exactly.
My last question would be, what is the best piece of advice you've ever received?
The most astounding piece of advice was from a dean of the school I graduated from in college. And she said, you need to always know your priorities, but you needn't share those with anyone else. And this was in the 90s. And she said, this is still an age where if a man needs to leave work at 3 p.m. to go to his daughter's birthday, he'll be lauded for that choice. But if a woman does the same, she won't be. Um, and I think some of that bias still is very present in our world today. And so I tend to be pretty private about, what are my priorities in life and how do I think about giving time to my family and community. And it doesn't need to enter into uh, dialogue at work entirely.
Absolutely. Well, I hope that in the future we see greater regulations around it, and perhaps, we're able to reverse time and create that environment again.
I know. I hope so for all the young people in the world. I really hope so.
Wonderful. Priya, it was absolutely wonderful having this conversation with you. I hope you had a good time.
I did. I'm really privileged that you asked me to join this conversation. Thanks so much, Sarah.
Thank you. We hope that you all enjoy this podcast as well. Please share, like, and subscribe, and let us know how you like this podcast in the comments below. Thank you, everyone, for watching. Thank you, Priya.
Take care. Bye-bye.
Goodbye.